I just believe that healthcare is a human right. Health equity to me means if they don't have the ability, if they don't have the access, if they don't understand or have the education to receive that healthcare that is their right, that we have to provide tools to be able to get them the care that they deserve. So this group is a community-based steering committee of just community members who care about healthcare, care about the health of our community.
When you're looking at health equity, you're really looking at what I feel like ministry is. But God said, when you have done it unto the least of them, you've done it unto me. So this group is ministering to the needs of not just the community, but what God has called them to do. And that's ministering to Him, as well as ministering to the people.
Equity for me is an opportunity for all. It gives you access, you get good insurance coverage, and education.
I've realized working in the medical field that a lot of people don't know a lot of things. Things that I think, or some people think is just common sense, to them, they don't know about it. But since I had a little schooling, it makes sense to me, but to them it doesn't. So I've always wanted to educate the people so they understand.
If you're not aware and you don't understand, you don't know what to ask for. And you just can't rely solely on somebody else to tell you. But with the knowledge, with the awareness, with the understanding, you're able to now not only have the skills to participate in your healthcare, but you also have the knowledge to be able to say, well, these are treatments that you haven't told me about. I would like to know about that. Is this something that's available or appropriate for me? You know, because we're not the healthcare providers, but what we are able to do is provide you with the education so that you can ask those questions to really get the best outcomes.
Right now we're on the project of prostate cancer and the disparities here in the community. Knowing that in Iowa, alone, it's one of the highest here for mortality rates.
I was a little bit shocked to learn about that. I would figure maybe like colon cancer or lung cancer, but prostate cancer being like the number one for Black men, I was kind of shocked because I have a son. And if I can take in that information as he gets older, then you know what to look for, you know what to ask, and you know what to do. I got brothers, uncles, and all of them, they don't ask those type of questions and they don't know. So if I can take all that information and pass that along, that'd be awesome.
I believe that if we educate the community and we go to the places where they gather, where community members gather, that is where we're gonna make the most impact.
You know, especially growing up, you can see where the healthcare is, where if you have money, you can buy anything. You can buy more time, but the people who don't have much, they need help, and I want to be there to help.